The intent of this video is to review the key principles related to preparing your IV medication and tubing for your Excelsior syringe pump. The process described in this video follows the written guidelines you received from your Providence Infusion RN during your admission teaching visit. First, you'll need to wash your hands and prepare a clean workspace, wiping it down and lining it with paper towels. Next, you will gather your supplies, including the waterless hand cleaner, medication syringe, syringe tubing, flushing supplies specific to your type of IV line, alcohol wipes, and a new sterile red cap if you have been instructed to use one. You are now ready to prepare your medication for loading into the syringe pump. Check the label on the medication syringe for your name, drug ordered, drug dose, and expiration date. Inspect the syringe itself for any leaking, discoloration, or unusual appearance. Call your Providence Infusion pharmacist with any concerns you may have regarding the medication or labeling. Remove the tubing from the package and remove the paper tape from the loop of the tubing. Remove the clear round cap from the end of the syringe end of the tubing. Do not touch the end of the tubing once the cap is removed. Then remove the red cap from the end of the medication syringe and twist the syringe onto the tubing. Always make sure not to touch the sterile tip of the syringe with your hand or any other surface. If you do touch the tip, it may be contaminated and you'll have to throw the syringe away. Push on the plunger of the syringe until you see a small drop of fluid at the distal end of the tubing. This is called priming the tubing. It fills the tubing with fluid and removes all the air from the tubing before connecting to the patient. When the fluid has reached the end of the tubing, clamp the tubing by sliding the white clamp across the tubing. You are now ready to watch the next video, which reviews loading the syringe pump and starting the infusion. If you have any questions or concerns regarding preparing your IV medication and tubing, please call us for assistance.